You have been taking prednisone for your rheumatoid arthritis. You went to the internet and start searching about the side effects. The high blood pressure, the high blood sugar, and the bone loss. You are scared. And you thought, let me just stop the prednisone. But here's the truth. Suddenly stopping prednisone could land you into the emergency room or even worse. In this video, I'm going to tell you about the truth on why you should not suddenly stop the prednisone and create a better plan on how to taper that steroid. At the end, I'll also give you a simple checklist on how to safely do the prednisone taper. Please stick around. Before I dive deeper, do me a favor. If you have ever been worried about the steroid side effects, please drop a comment below saying me. I read every comment. Let's also hear from all of you on how you are handling this steroid. Hi, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, as well as a practicing rheumatologist here at Empower Arthritis and Rheumatology Center. Today, I'm going over a very important topic in rheumatoid arthritis management that also includes other autoimmune diseases too, on how to safely taper steroid and what are the advantages and disadvantages of suddenly stopping the prednisone. Before I go further, don't forget to like and subscribe to our video and also accept our gifts. That includes a free copy of our book, the Holistic Rheumatoid Arthritis Guidebook, as well as a free smoothie that you can prepare every morning to fight against rheumatoid arthritis so that you don't need to go to those steroids. Now, let me start with the story of one of my patients. She is 52, who has history of rheumatoid arthritis for several years, and she came to me on 10 milligram of prednisone for several years. One day, she thought about suddenly stopping the prednisone, and so she did. But unfortunately, she landed in the ER after 3 days of stopping prednisone. She came to the ER with low blood pressure. She even could not speak. She was having a lot of other symptoms. Now, can you guess what she has? So she developed what we call adrenal crisis due to suddenly stopping the prednisone. So let me help you learn about how you can safely taper the steroids so that you don't land up in the ER or even more serious problem in your health. Let me start with the first question. Who need a steroid taper and who does not need a taper? And starting with the first question, who does not need the steroid taper? If you have been taking steroid for less than 3 to 4 weeks, you usually don't need to taper. You can stop the prednisone without needing the taper. So your adrenal gland, which typically make the cortisol, is still fully functioning. So when you stop the prednisone, it will make up for the cortisol level. So the magic number is 3 to 4 weeks. But even for this, always ask your doctor on how to safely taper your steroid. Don't do it by yourself. So the most important question, if you are taking steroid for more than 3 to 4 weeks, then you definitely need to slowly taper the steroid. And here is the reason. So our body typically make a natural hormone called cortisol. So you can think of cortisol as a natural hormone made by one of the glands called the adrenal gland. And these are two glands on top of your kidney. They typically make this cortisol hormone to support your bodily function. And when you're taking steroid, the outside steroid, this adrenal gland does not function very well. And you can even see in the picture on the right side, the adrenal gland has become smaller. And the smaller adrenal gland is not making enough cortisol. That's why you need to give enough time to the adrenal gland to make enough cortisol before you stop the steroids. And you might also ask, what is the risk? Why can't I just stop the prednisone? And I call we need to have a safer landing. If you're taking long-term steroid, we need to slowly taper so that you have a safer landing of coming off of the steroid. And suddenly stopping could be risky, like our patient we talked earlier. And let me also try to make it a little more simple. So you can think of your adrenal gland as a factory that make cortisol, and your adrenal gland make this cortisol every day. And cortisol helps in handling stress, maintaining your blood pressure, and even fighting infections. So your factory follows a good schedule. It usually makes the cortisol typically high level in the morning. So it has a good routine. Every morning, it makes higher level of cortisol. When you take this external corticosteroid in the form of like prednisone or methylprednisolone or any other form of chronic steroid, your body thinks that the factory does not need to produce any cortisol. So your factory, the adrenal gland, go to sleep. And when your adrenal gland is in sleep, it is not making any cortisol. So when you suddenly stop the prednisone that you are taking, then you don't have any steroid in your body. That's how the adrenal crisis happens. Your body is not able to handle that lack of cortisol, causing severe health concerns. Now, here are some of the danger of suddenly stopping the steroid, and we call that adrenal crisis. And it could be a medical emergency, which could take you to the ER or even worse. And here are some of the important symptoms of adrenal crisis. The number one being severe weakness and fatigue, very low blood pressure, nausea and vomiting, and even confusion and passing out. That's why it's a very risky situation if you suddenly stop your prednisone. The other question is, how long does it take to recover when you are slowly tapering your steroid? Your steroid withdrawal can take up to many weeks to months. It varies from one patient to the other patients. Some of you might be able to come off within few months, but it can even take up to 2 years to fully get back to normal. So your adrenal gland, the factory which make cortisol, take a lot of time to recover. And the rule of the game is the longer you are on the steroid and the higher the dose, the longer it might take to recover from the adrenal insufficiency. When you are slowly coming down on the prednisone, you might also get symptoms of what we call steroid withdrawal. Now, here are some of the important symptoms of steroid withdrawal. That includes joint pain and muscle pain, headaches, mood changes, feeling very tired, trouble sleeping, and mild flare-up of your disease. So these are the symptoms of steroid withdrawal. Now, let me differentiate between these two important ideas. The one is the steroid withdrawal and other one is the adrenal crisis. Those are two separate conditions. In steroid withdrawal, it's a mild symptoms. It's uncomfortable but is not dangerous. So the steroid withdrawal is uncomfortable but not dangerous. Your body is just trying to adjust to a lower level of steroid. That's why you are feeling those mild symptoms. And it typically gets better with time. But the adrenal crisis is a medical emergency. You have severe symptoms, severe weakness, vomiting, confusion, and very low blood pressure. Even it could be life-threatening. So it's very important to understand these two concepts of steroid withdrawal, which are mild symptoms, and the adrenal crisis, which are more severe symptoms, which will need immediate medical attention. Now, let me give you some safe steroid withdrawal plan. So step one is a quick drop. So if you are taking very high dose of steroid, typically more than 50 to 60 milligram, your doctor will rapidly decrease the level of prednisone and they come down to a lower level. Now, the step two becomes the slow and steady, where your doctor will slowly decrease from that lower level of the steroid. The step three is the checking in. Your doctor might also measure the level of cortisol in your body, typically in the early morning. That will tell us whether your adrenal gland is already waking up or not. So here are these three important steps. The step one, the quick drop. The step two is the slow and steady. And the step three is the checking in, checking the level of cortisol to tell us whether your adrenal gland is already waking up or not. In this journey of coming off of the steroid, always use your doctors, your primary care doctor, your rheumatologist as your partner. They will help you guide on how to safely decrease the prednisone. Now, the goal, your goal and your doctor goal is the same, is to get you off of the prednisone, but we have to do it very safely. Now, in the rheumatoid arthritis, we have so many different medications. We call them disease-modifying anti-rheumatic drugs or biologics that will help you decrease your prednisone and also control your rheumatoid arthritis. So we can safely do both. We can taper the steroid, we can also control your disease, but we need to have a good plan. So always create a good plan with your rheumatologist. Always watch out for those symptoms of steroid withdrawal and even adrenal crisis. And also have a regular checkup with your doctors. Checking your cortisol level could be helpful. And always work with your rheumatologist to adjust your rheumatoid arthritis medication so that you don't go into a flare when you are decreasing your prednisone. So it's very important to have a continuous communication with your rheumatologist on how you are feeling as you are decreasing the prednisone and also monitoring your disease activity. Now, as I mentioned earlier, so here is the easy checklist for you that will help you decrease your prednisone safely without causing health crisis. The number one, never stop suddenly without talking to your doctors first. Number two, keep a diary of your symptoms to understand both the symptoms of steroid withdrawal as well as the disease flare. Number three, be patient. It takes time for us to safely decrease your prednisone, so have patience. Number four, follow your plan exactly as your doctor has told you. And the number fifth, if you are taking steroid for a long period of time, typically more than 3 to 4 weeks, wear a medical brace so that people are aware if in case of emergency you need extra steroid or you are on prednisone. So wearing a bracelet could be a lifesaver for you. And if you have any questions, always call your doctor. Don't taper your steroid suddenly without consulting to your doctors. So here's the take-home message. So tapering steroid is like a landing a plane. You cannot just drop from the sky. Your body needs a slow and safe landing. Always work with your doctors. You are the pilot, but you have a coach. You have a coach, your rheumatologist and your primary care doctor. So use them for your safe landing when you are trying to decrease your prednisone. Thank you all of you rheumatoid arthritis warrior for watching this video. If you like the video, please give us a thumbs up. Subscribe to our channel so that you can get these type of contents to help you understand better about rheumatoid arthritis. And also don't forget to accept our gifts. The two gifts that we have, one is a free copy of the book as well as a recipe of the anti-inflammatory smoothie that you can prepare every morning. And if you follow those, you may not even need to be on steroid. And I'll see you in the next video. Bye-bye.